few minutes and go over our new payday terms for weeks 1 and 2, just really quickly. So let's look at number 1, insurance. We're going to talk about insurance and healthcare kind of as a whole in the next couple weeks. So insurance is financial coverage by contract in which an organization reimburses or pays for something that is stated in the contract upon specific conditions. Basically, insurance is just something that helps you pay in case of healthcare costs that come up. So, and you guys know that, or any kind of cost. I mean, you can have any kind of insurance. So you pay car insurance, you pay a little bit every month so that in the case that something big comes up and you have to pay a lot, they will help you pay that. That's all insurance is. It's just there's specific things that they will cover, won't cover, and then they either reimburse you or they reimburse the company that you use to get the service. Hold on 2 seconds. Let me make sure. Yeah, financial coverage that has a contract that helps to pay for things. Healthcare, car, whatever that may be. Let me go to this next little area. Okay, an epidemic. Epidemic is just widespread disease in a specific location. So many of you guys have been hearing about the Ebola epidemic, and that's in like Western Africa. So that's an epidemic. It's affected this one area, but it's affected large numbers of this one area. Treatment. This is what is done or given to a person to help their disease or condition. So treatment can include many things. It can be therapy, it can be considered treatment, like physical therapy. Medicine can be considered therapy. What else? All kinds of stuff. Treatment, I'm sorry. You can do hydrotherapy, that can be treatment. There's wound care could be considered treatment, any of those things. A provider, this is someone that provides medical assistance to a person. It could be a physician, can be a provider, a nurse can be considered a provider, a company can be considered a provider, like a home health company or something like that. Physician is just a fancy word for doctor, so whenever you hear that word, it means the same thing as doctor, physician. Geriatric, this means pertaining to the elderly. So it just has to do with elderly, like geriatric care is care of the elderly people. Or geriatric, sometimes you'll hear the doctor who specializes in geriatrics. That's just care of older people. Hospice, this is a very specific type of healthcare that's given at the end of life. Typically, people can't get on hospice until the doctor has given them a maximum of, I think it's 6 months to live. And that looks like lots of different things. Nursing care, medications, all kinds of stuff. Ambulate means to walk. That's just a fancy word for walk. Resident, this is a patient in a nursing home or an assisted living. Somebody who kind of lives at the place where they are getting care. They don't like to be called patients. They like to be called residents. Rehabilitation, this is a process of regaining physical or mental abilities, or the process of teaching someone to live with their disabilities. So both of those, rehab is kind of typically like I put down below, it's like your typical abbreviation. Okay, the next few things are abbreviations. Now, PRN, I know you're like, that means as needed, that's so weird. Well, a lot of these abbreviations won't match up with the word, and that's because they probably come from the Latin word, or Greek, could be Greek, but typically Latin. So PRN is just a word for as needed, like maybe I work at the hospital PRN, so they only call me in when they need me. Or I take Tylenol PRN. I only take it as needed for a headache. That's what PRN means. It can take on lots of different things, but you will see that a lot this year, so you might as well learn it right now. EMS is emergency medical services. Could include ambulance care, could include EMTs, all of that. MD is just medical doctor when you see MD behind somebody's name. And then VA is Veterans Administration. And the VA, which we'll talk about, I think next week, is it's just a hospital system that takes care of veterans, people who fought in war or were disabled in, or not disabled even necessarily, but have injuries that were related to their service in any of the armed forces. And there's some other rules that includes, there's lots of people that are included that can receive care from the VA. So those are your terms. We'll test over those next week, and so we'll do that. If you have any questions about it, make sure you let me know.